an adolescent, a chronic nightmare is a neurobiological crisis. It represents a failure of fear extinction, the brain's inability to recognize that a threat has passed once the dreamer wakes up. Instead of resetting, the developing brain remains in a state of chronic physiological arousal, treating the imagined threat as a present physical reality. Clinical psychology has historically addressed these disturbances from two distinct poles. On one side, cognitive behavioral therapy aims for pure symptom reduction. On the other side, classical depth psychology, pioneered by figures like Carl Jung, views the nightmare as a symbolic message requiring translation. When trauma is both neurobiological and systemic, the clinical challenge becomes one of alignment, integrating these disparate methodologies into a single functional framework. This is the Neo-Jungian synthesis. It combines the structured cognitive mastery of imagery rehearsal therapy, the deep symbolic engagement of Jungian active imagination, and the contextual mapping of family systems theory. To see how this synthesis operates, we examine the case of Tammy, a 16-year-old patient. Tammy was navigating an unplanned pregnancy while trapped in a state of intense psychological fusion with her family, meaning she struggled to separate her own identity from her parents' demands and patriarchal expectations. The crushing weight of these systemic pressures triggered a series of terrifying nightmares that completely stalled her therapeutic progress. To move forward, these nightmares were treated as systemic barometers, revealing the specific psychological tensions Tammy needed to resolve to achieve individuation. Tammy's first nightmare was the zombie dream. In it, she was relentlessly pursued by a horde of mindless figures, attempting to infect both her and her baby. Jung argued that dreams do not disguise reality, but rather present the unvarnished truth of the patient's waking state. In her waking life, Tammy was caught in a systemic double bind. Her father demanded she take responsibility for her pregnancy, yet he simultaneously enforced her blind obedience to his authority. We map this dynamic using the circumplex model, measuring adaptability and cohesion. Systems resisting role changes are rigid. Those lacking emotional bonding are disengaged. Tammy's family plots into this lower left quadrant, marking them as structurally rigid and emotionally disengaged. Because the system refused to adapt to her new reality, Tammy became the identified patient, absorbing the family's shadow and her parents' projections. The mindless zombies in her dream mirrored this waking state of automatic, unthinking reaction. The intervention involved guiding Tammy into a mild trance to re-enter the dream using active imagination. In her trance, Tammy chose to stop running. She turned to face the zombies, yelled at them to back off, and outmaneuvered them. This internal resolution acted as a catalyst. By confronting the dream imagery, Tammy began to move out of the desolation of the Negredo phase, translating her dream state defiance into the first steps of waking differentiation. As Tammy began to separate from her family, she faced a new stressor: severe bullying at school regarding her pregnancy. She then dreamt she was being forced into a dark wedding with a vampire, while her father officiated. To address the resulting hyperarousal, the therapy integrated imagery rehearsal therapy, or IRT, which utilizes cognitive rescripting to alter frightening dream content. For adolescents, IRT is adapted by having the patient draw the original dream and the new script, making the abstract exercise concrete and improving visualization. The core IRT requirement is that the rescripted narrative must place the dreamer in a powerful position, shifting their self-perception from victim to the boss of their own dreams. Active imagination was then layered onto this framework within the therapeutic temenos, or safe container. Tammy entered a trance state and engaged in a direct dialogue with the vampire figure. The dialogue revealed the figure was not a victimizer, but her own repressed animus, fierce shadow energy she needed to protect herself. Integrating this shadow energy provided the internal resources Tammy needed to stand up to her bullies in waking life. This dual intervention addresses immediate physiological distress through IRT, while using animus integration to build the internal resources necessary for long-term psychological resilience. Even with these tools, adolescents often lack the vocabulary to articulate complex internal psychological states. When words fail, clinicians can utilize cultural amplification to tap into the collective unconscious. Music and pop culture often function as modern mythological frameworks, providing youth with a set of ready-made symbols for universal human struggles. To bridge this communication gap, Tammy brought in Madonna's Papa Don't Preach. The lyrics provided a direct archetypal expression of her personal father complex. The narrative of a young woman asserting her autonomy against patriarchal control mirrored Tammy's real-life struggle for individuation. Utilizing this musical framework provided symbolic information that bridged the gap between her unconscious feelings and conscious understanding. Leveraging the collective unconscious through pop culture provides the symbolic vocabulary necessary to navigate a clinical impasse, allowing the therapist and adolescent to communicate through a shared archetypal language. Clinical progress transitions here into the albedo phase. This is a period of whitening and clarity, where emotional desolation gives way to structured psychological integration. The catalyst for this integration was the decision to engage the nightmare as an active, living entity, rather than a passive symptom. This active process severed the fusional complex, allowing Tammy to detach her identity from her family's pathology. We can consolidate these clinical steps into a three-pillar framework. Pillar 1, imagery rehearsal therapy, provides physiological fear reduction and cognitive mastery. Pillar 2, active imagination, extracts symbolic meaning and allows for shadow integration. Pillar 3, the circumplex model, contextualizes trauma and repairs systemic boundaries. This synthesis suggests that effective adolescent dream work requires the therapist to move beyond the role of a shrink who reduces symptoms, acting instead as a stretch, expanding the patient's capacity to integrate their unconscious and author their own reality.